So, doctor, I wanted to come here because I've heard all about your procedure online. And, I really wanted to find out what it's all about. I have some people in my family and my life that have struggled with weight loss. And, I want to give them all the options that's out there. Sometimes slim teas just don't do the job.
Absolutely.
Sometimes, having the energy, the momentum to go work out every day, or even just the time is not available. So I wanted to just really find out about this groundbreaking procedure I've been hearing so much about.
Sure. So
how it works.
The Suture Sculpt, or the endoscopic sleeve, is really a revolutionary procedure. What makes it so special is that it is not an operation. We don't cut anything.
So there's no like tummy tuck scars?
There are no scars whatsoever.
Okay.
I don't cut anything. I don't change the continuity of your intestines or your plumbing. I don't change your blood supply, your nerve supply, or the absorption of nutrients from your intestine. There are no scars. Everything is done endoscopically from inside your stomach. This procedure is not minimally invasive, it is non-invasive, non-surgical. This procedure is relatively new in this country. This procedure has been around for about 7 to 8 years, mostly in Spain and in Brazil.
Okay.
That's where I went about 6 years ago to learn this procedure, and that's where I became an expert at it. In this country, only a handful of people are doing this right now. At Harvard, up in Boston, at the Mayo Clinic in Minnesota, and University of Texas in Houston. New York is a big center. I do a lot of these procedures, and we're getting incredible results. So specifically what I do with this procedure is I just fold your stomach the way, if you know what an accordion looks like. So instead of cutting your stomach, I make it smaller with an accordion effect with sutures. I sew it. I sew the stomach smaller by folding it with the sutures. Okay. And essentially what I end up doing is I make the stomach shorter and I make it more narrow.
So in turn, you eat less and get full faster?
Absolutely. So essentially, the patient who does this procedure, what does she say? She says, before the procedure, I needed 20 bites to feel full. Now, after the procedure, the patient tells me, I only need 3 or 4 bites to feel full, and we're not done. And then you're not hungry for 6 or 7 hours, because essentially what I do with this procedure is, number one, I delay the emptying of food from the stomach. So the food just sits in your stomach for about 6 or 7 hours. Because of this prolonged sense of fullness or satiety, the stomach sends a message to the brain saying, hey, I am full. The brain has to actively process this message, and then it gives out a command, okay, you're no longer hungry, stop eating. That's number one. And number two, we take your stomach, which is your reservoir, your gas tank. Right now it's this big. When I'm done with the procedure, I make that reservoir smaller by 70 to 80% so that it becomes this big. So again, what the successful patient says is, before I needed 20 bites to feel full, now I'm full after 3 or 4 bites, and then I'm not hungry for 6 or 7 hours.
So what's the recovery time on something like this?
The recovery is a relatively an easy recovery.
Really?
It's about 2 to 3 days.
Oh,
what you feel is mostly abdominal pain. It is similar to surgical pain, but it is way less intense. Obviously, we're going to give you medications to control the pain, and you're going to be very comfortable. So it is not a hard recovery at all, so you should not be afraid of the recovery. The average person who does this will lose anywhere between 15 and 21% of their total body weight, which is incredible.
Yeah.
I mean, so essentially an average person.
It sounds like the gastric sleeve that some people get, but it just sounds like it's a less invasive form of that.
Correct. So it is very similar to the surgical sleeve, but there are very important differences.
Okay.
Okay. So this is how I explain it to the patient. With the surgical sleeve, you definitely lose more weight. It's 25 to 35% of your total body weight. With our procedure, it's 15 to 21%. So how do I interpret that? This is how I look at it. If a person needs to lose 100, 150, 200 pounds, the only realistic way of getting there is surgery. However, surgery comes at a price.
Yeah.
And the price is complications. So with surgery, 35% of people who do the surgery will develop severe acid reflux, which is very difficult to treat even with medications. 5% of patients who do surgery, their acid reflux is so bad they require a second operation just to fix the acid reflux.
Wow.
With our endoscopic sleeve or suture sculpt, nobody gets acid reflux. If anything, we make acid reflux better. And the third point that's very important to understand is that our procedure is significantly safer than surgery in terms of complications. The biggest complication after this procedure is something we call a gastric leak or a little hole in the stomach. With surgery, that happens about 32 out of 200. With our procedure, 1 out of 200. So our procedure is 30 times safer than surgery. And what I tell people is that our procedure is safer than giving birth. We men are chauvinists. We think that giving birth is easy. It's like going to get a haircut.
No, it's
but
not.
You ladies
not
know better than that. You know that it's not easy at all. I think that this procedure is safer than giving birth.
Wow. So, you know, there are a lot. I'm going to actually post this because I like just giving my community of followers information about different things. And I know that this is something that's new. So anything that's groundbreaking, that's new, I like to share just so people can know, you know, what's happening, what's going on out there, what are the new things that people are doing that are, you know, is it something that's economical? Is it something that is affordable? Is it less expensive than surgery? And is this something that health insurance sometimes covers?
Okay, so health insurance at this point does not cover this endoscopic procedure. We make it very affordable. It is about a third of the price that the surgery would cost. And obviously we have payment plans. The one point that's very important to make is that even of all the patients that are eligible for surgery, do you know how many people actually take advantage of the surgery? 1%.
Really?
And the reason is when you talk to people, why won't you do the surgery? Clearly you need some help to improve your health. In other words, to prevent you from developing diabetes, from developing high blood pressure, heart disease, sleep apnea, fatty liver. You know, patients who are overweight or obese have a much higher rate of developing all sorts of cancers. So when you ask patients, why wouldn't you do this procedure, this surgery that can give you so many health benefits, and the most commonly given answer is, I'm afraid of surgery. I don't want anybody cutting me. So the beauty of this procedure is that we don't cut anything. We don't change anything. Not your blood supply, not your nerve supply, not your absorption of nutrients. So by introducing this non-invasive endoscopic method, we're hoping that instead of 1% of patients taking advantage of this procedure, we can increase that number to at least 10%. The other thing that you need to understand is that even though most insurances will cover surgery, in order to qualify for them to cover your procedure, there are very strict criteria that you have to adhere to. Your BMI has to be greater than 40. And you know, When your BMI is greater than 40, that's type 3 obesity or morbid obesity. Okay, that's nice, but how about other patients who have type 1 obesity, type 2 obesity? In other words, moderate obesity.
Right.
Or patients who are considered to be overweight. They need help as well.
Yeah.
These people who are not morbidly obese, they clearly need help as well.
Yeah.
They don't even come close to qualifying for surgery, whereas with our endoscopic procedures, we have a lot of leeway in terms of helping the overweight person, the slightly overweight person, or the person with mild obesity or moderate obesity. You don't necessarily have to be morbidly obese to qualify for
that was
this.
going to be one of my questions, because my family members, I don't know that I would consider them obese, but I know that they've struggled with being overweight and wanting to have weight loss, or even doing quick fixes like cleanses. When you do those cleanses, the minute you start eating again, the weight just comes right back. So, I went on this journey to just research what other options were out there, and your name came up, highly recommended. So I wanted to just do research, sit down, and then just share information with my community out there to let them know kind of what options are there. And, I'm big on, building health and building wealth. So I also wanted to make sure this was something safe and something that I understood before I even, recommended it to my family members or my friends or my followers.
The one thing that I think that's important to mention is a lot of us, we try for the quick fix.
Yeah.
And multiple studies have shown that high intensity diets, with or without appetite suppressant medications, over 95% of them fail.
Yeah.
Unfortunately, the reason for that is because our brain has a set point. And when you're dieting and you're trying to lose weight, the brain doesn't understand that you want to lose weight.
Right.
The brain thinks that we're still living in the caves thousands of years ago, and that when you don't eat, the brain thinks that you're going to die. So the brain goes into a survival mode by decreasing your energy expenditures, number one, and number two, by markedly increasing your hunger hormone, the ghrelin. And so when patients do the diets or take the medications, they'll be successful for 2 weeks, a month, 2 months, 3 months. But then the brain takes over, and these high hunger hormones, they pull you back to that set point.
Yeah.
What this procedure does is it allows your brain to have a new set point set. And that's what's important. So think about it. This is a procedure that's accessible probably to every second or third person out there.
Wow.
From mildly overweight, mild obese, moderate obese, or even the morbidly obese. It is a much safer procedure. With surgery, patients have to stay in the hospital for 3 days, and then their downtime is a month.
Yeah.
With our procedure, we send you home the same day.
Wow.
My part of the procedure takes about 45 minutes. We observe you for a couple of hours, then we send you home the same day.
Wow.
And
now, do you have to wear garments and all that kind of stuff?
No garments.
Oh.
In 2 to 3 days, you're ready to go back to school, you're ready to go back to work. Patients ask me, when can I start exercising? And I tell them, depends on how soft or how strong you are. As soon as you have the energy and the desire to exercise, if you want to exercise on the second day after this procedure, knock yourself out. I've had patients who've gone back to school and to work the next day.
Wow.
Now, I can't guarantee that that's going to happen with everybody, but your downtime is literally 2 to 3 days, and then your life continues.
Nice.
And besides all the health benefits that you derive from this procedure, it doesn't hurt that you're going to look amazing in that bikini.
Right.
That's a nice little benefit.
Yep, exactly. This is interesting. I'm so thankful that you took the time to tell me about it.
My pleasure.
Let me see if I have any more questions. I'm trying to think of what my family will say.
Anything you want.
What my friends will say.
Give me some hard questions.
Okay, a hard one.
All right.
What are some of the downfalls? What are some of the risks that you've seen, that you've heard, that you know exists with doing this procedure?
Okay, so this is an incredibly safe procedure. As I said, you can get a gastric leak or a little hole in the stomach.
Okay.
It's extremely rare with our procedure. When it does happen, in 95% of cases, we can just take care of this conservatively with antibiotics alone. In extremely, extremely rare cases, in less than 5%, a person may require surgery to fix the hole. That's incredibly bleeding with this procedure. It's rare, but when it happens, it usually happens during the procedure. Part of my job is to make the bleeding stop. That's what I do, so not a big deal. There have been reports of some adjacent organs being damaged with this procedure. There are 2 reports of the gallbladder being damaged and about 5 reports of the spleen being damaged with this procedure. This is out of 40,000 cases over a course of 7 years. So yeah, it can happen theoretically, but it's extremely rare.
Okay.
This is an incredibly safe procedure, and it's effective.
Right.
But what you have to remember is this is not magic. I'm not creating magic here. I don't do miracles. I am not a holy person. In order for this procedure to work, you must have discipline. What does discipline mean? I mean, let's get to the nitty-gritty.
Yes.
Easy. 2 things. I like to simplify things. 1, eating healthy. That's important. That's discipline. And number two is 100 times more important than number 1, portion control.
Portion control.
If you can do portion control, you will succeed. If you can't, you won't.
Got it.
Okay? So what you need to understand that I think the procedure is the easy part, especially when you go to somebody who has done such a high volume of these procedures and is highly expert at this procedure. I would tell you, and I don't like to brag, I just like to state facts. I'm one of the few people in the world who does this at such a high level. I will do a great job.
Yeah.
Okay? But remember, the procedure is the easy part. The hard part is controlling the brain afterwards. And, we help you. In order for you to succeed, an integral part of this whole process is nutritional counseling.
Yeah.
We're going to teach you how to eat healthy. We're going to teach you and show you what your portion should be. We're going to support you every step of the way. And multiple studies have shown that when patients are very compliant and they come in for the nutritional counseling, those people do a lot better than the people who think, oh, I know it all, I don't need anything.
Yeah. That was my question. I was going to say,
you gotta be motivated.
After this is done, is there constant support?
We want to see
and how long is that process?
Right. So at least for 2 years, that's what I strongly recommend. And I strongly recommend that you come in at least once a month. If you need more than once a month, no problem.
Got it.
Okay? I'm a big believer that in order to be successful in life, you have to go to somebody who has a lot of experience and who does this all the time in a high volume. That's what we do. I don't do anything else. I just do endoscopic weight loss. I'm a big believer you do 1 or 2 things in life at which you are the best in the world, and you have to believe that you are the best in the world. I'm not one of those people who likes to dabble and do a little bit of everything.
Right.
I pick 1 or 2 things, and those are my areas of expertise.
Got it.
And nobody's going to do it better than me.
I love that. Okay. Well, I mean, I think you answered the hard question. I got all the information. I want to definitely spread this information. So it's the endoscopic sleeve or
Suture
sculpting. Got it. So that's going to give that Coke bottle shape that these ladies want.
Absolutely. One last point that I want to make. A lot of ladies make the mistake of trying to lose weight by getting a tummy tuck, by getting lipo. And unfortunately, those procedures are not meant for weight loss, number 1. And you're not going to get such great results, let's say, with a tummy tuck or abdominoplasty, if you're at a weight that's too high.
Yeah.
What's really important to do, if you really want to optimize the results of whatever procedures you do, first, you need to lose the weight.
Yeah.
You need to lose the weight with the Suture Sculpt, with the endoscopic sleeve. Once you've lost the weight, then you do lipo, then you do the tummy tuck, and those procedures at that point become contouring procedures.
Got it.
They give you that shape that you want.
Mm-hmm.
Okay, and that's the proper order. First, you have to lose the weight. So I just wanna make sure that people understand that this procedure is not specifically just for women. This procedure works really well with men as well.
Yeah.
Men do very well with this procedure, as do women. It's very important to understand, and most men do not understand this, that when it comes to weight loss or weight gain, women have it a lot tougher than men do. I did not appreciate this 5 or 6 years ago, but now I've been re-educated, so now I'm very sensitive and I appreciate all this. But all joking aside, it really is so much harder for women. Why is it so much harder for women? Well, with each menstrual cycle, your hormone levels go from here to here to here. So that's one part of why it's so hard for women to lose weight. Number two, after women have children, their metabolic rates really decrease, and it becomes, they put on the weight, and it's very hard to lose the weight. And then number three, when a woman gets to be around the age of menopause, essentially what happens to the metabolic rate is that it doesn't just decrease slowly like this, it almost falls off the cliff. So I think that it's important both for men and women to understand that when it comes to issues of weight, it is much, much, much harder for women, and it's important to be sensitive to this fact. And this procedure is a wonderful, wonderful tool. Not magic, but a wonderful tool to help men, but more so women, in accomplishing what they need.
Got it. Well, thank you for that information. That's important. Well, there you have it. I wanted to do my own research, and I wanted to make sure I brought you guys all in. So I'm going to spread this information to my family members that were asking about it. And, if you don't mind, I would love for you to just let them know how to reach you.
Absolutely.
If they have more questions or, comments, I'll take your number too. Okay,
so our number is 718-830-0004. Batashmedical.com. Come visit our website, peruse it, look at our Instagram.
Tell them your Instagram.
Stephen Batash MD. We have a lot of procedures. The procedures that we do, we have actual both real life demonstrations of these procedures, as well as, and we have a lot of posts that explain the finer points of this procedure. I think you'll really enjoy it.
Well, thank you so much. I can't wait to educate everybody about it.
Pleasure to meet you.
It's good meeting you too. So I definitely want to have my sister come talk to you.
I would love to see her.
Yes, because she has been struggling.
Okay. That's what I'm here for.